Part 4, we're going to continue talking about evidence-based practice, and there are barriers to evidence-based practice. And it's amazing. What we're teaching you right now, what we're teaching you at LTC, in your clinical settings, in your skills classes, this is the best current knowledge that we have. Unfortunately, we do such a good job at teaching students that almost all nurses look back to their nursing school for their nursing knowledge. Even 20 years later, they're still saying, well, I was taught this in school. This is how I'm supposed to do it. And in 20 years, a lot of things change. So what we're teaching you now is the best practice right now. In 5 years, I hope you're doing something different, because you probably will need to do something different. Most nurses don't read research-based journals. Most nurses, if they read nursing journals, are reading, Nursing 2015, American Journal of Nursing, and those are good journals. Don't get me wrong; they're fine journals, but they're not research journals. They're not evidence-based journals. And most nurses just don't read that. A lot of nurses are very uncomfortable with library and search techniques. There's challenge in understanding and interpreting research reports. And there really is little organizational support for researching. Those of you who work as an LPN, and I'm certain there are some of you, how much time do you have on the job? On the job to do research? Where your unit manager says, oh, just go do some research for the next 4 hours. Right. Doesn't happen, does it? Nurses want to do. They don't want to research. They want to do. And there really isn't a simple and effective way of having time to research or implementing it. And that's the shame. So we're looking for evidence-based practice. We want to make sure that you understand how to look at the evidence, because there's a lot of research out there. It doesn't mean it's all good. Okay? So the first thing you do, if you decide that you're going to actually research something, the number one thing you must do is ask the right question. You must have the right question. If you don't ask the right question, you will not get the right answer. And that's the hardest thing for nurses to do, is to find the right question. You need to do some literature researches, and they need to be critically appraised research at the basic level. And then we need to determine how well the evidence-based intervention actually works when things are involved. Now, going back to asking the question. To ask the right question, you have to be able to create a PICO or PICO. I'm never sure how it's pronounced. I say PICO. You have to be able to create a PICO question, which is PICO, patient population, the intervention or interest, the comparison group or comparison intervention or group, and the outcome. So when you learn how to ask that question using the PICO, then you'll be able to get good research. But if you don't use PICO, if you don't use PICO, you will not be likely asking a good question. And that is the hardest thing for nurses to do, is ask that good question. Now there's levels of evidence. If you look like a pyramid of evidence, the peak of the pyramid would be a meta-analysis of all relevant randomized controlled trials. A meta-analysis pulls in many, possibly dozens, hundreds of research, pieces of research, and then puts all that together to come up with an overall analysis. And that is the best level of evidence. Very complex, very expensive, so they're not very common. But if you can find a meta-analysis that answers your question, very likely you have the best possible answer for your question. And then you can have controlled studies, where you have a control group and an experimental group. You can make it even better by making it random, where you have a control group and a random group, but nobody knows who is who. You can do observational. where you basically are observing and you're looking for correlations between actions. And then the last and lowest level of evidence is expert opinion or multiple case reports. Now, that doesn't mean expert opinion is wrong. It just means it doesn't have the same strength of backing as a meta-analysis or a controlled study. And you've maybe heard of blind and double-blind studies. In a blind study, there's blind, double-blind, and triple-blind. In a blind study, the participants, do not know if they're getting the medication or the placebo, but the testers do. It's not common to use a blind study because testers have a way of subtly influencing people. So they go with double-blind. In a double-blind, the testers don't know what they're giving their patients, and the patients don't know what they're getting. So it's impossible for the tester to influence the patient. In the triple blind, the patients don't know, the testers don't know, and the person who correlates all the evidence and analyzes everything has nothing to do with the study. It's an independent agency that actually does the analysis. That's a triple blind. Most complex and most expensive, of course. There are ways of researching, or places to research. If you in the library, you can do a CINAHL search or an Ovid search. And those are good searches. They're not the best searches. They're good in that they have a lot of resources and a lot of research. But they also contain non-research-based materials. If you do a CINAHL search for catheter-acquired urinary tract infections, you'll come up with a lot of evidence and a lot of articles and a lot of opinion pieces, and you'll have a lot of everything related to that. There will be some research, but not all research. If you go to guidelines.gov, that is sponsored by the AHRQ, the Agency for Healthcare Research and Quality. Healthcare Research and Quality. Everything on guidelines.gov is evidence-based. So guidelines.gov is the best place to find evidence-based research. You can find a journal. You can open up a journal. You can do that. You can go to online resources, and those are good. You'll find evidence there. Guidelines.gov, it's only evidence-based research and is the best place to search. So what happens when you find research results? Well, first we need to look at what you find, and we look at previous findings versus what's currently believed. We want to do some research to develop a new approach using either qualitative or quantitative approach. Qualitative meaning better outcome, quantitative meaning a greater number of processes. And we have to differentiate between nursing and non-nursing research. A nursing research, it's run by nurses, it's done by nurses, it involves nurses, it's only nurses. And it'll be published in something like Critical Care Nursing. I can't think of other nursing journals, but they would be research-based journals that have nursing in the name. Journal of Pediatric Nursing, let's say if that's one. Those are nursing. Those will be nursing research pieces. If you go to Journal of American Medical Association, JAMA, great journal. It's medical research. If you go to New England Journal of Medicine, medical research. The Lancet, British medical research. Great research, not nursing research. And that's going to come to play when you do your advocacy paper. I want nursing research. So what happens when you find your research articles? How well do you have to understand the articles? Well, when you have a question with no appropriate guideline already in place, you have to understand very carefully. New research is important to really understand the new research rather than something that's been out for 2 or 3 years, because that has been more than likely put into practice and used. And then finally, you need to consider is this research relevant to your practice? Suppose you work on women's health, and research is found in Journal of Gerontological Nursing. Probably not going to be real relevant. So you want to make sure that you grab relevant resources. So when you do your research study, you're going to review the research abstract for your PICO question and brief summary. That's the first thing you're going to look to. What is the abstract? What is the summary? That'll tell you in a basic, brief nutshell the end result of this study. And then you want to look at the sample. Does the sample represent your population in terms of age, gender, socioeconomic, ethnicity, medical diagnoses? Was the sample size reasonable? Usually, bigger is better. Almost always you need like at least an N of 30 or more to really be valid. So if you have a research that's based on a sample size of 6, it might be valid. It might be real. It might not be really valid in the big picture because that's looking at 6 people. Research that has 6,000 can more likely be much more applicable to everybody. And is there a comparison group? Is there that control group versus the test group? Not a before and after of one group, but is there a group that you're looking at concurrently so you can see changes? Without that, that's really hard to measure what was really the changes. We're going to look at the setting. Was the setting done in acute care, long-term care, home care? Is this relevant to your question? It may not be. We're going to look at the design and the conclusions and limitations. Excuse me. The statement that there is significant findings, if they say there are significant findings, that usually means that the end result was not due to chance alone. So if there's something that says it's significant, that actually means it's a real change. And then you're going to look at inverse and positive correlations and relationships. What does that mean? Positive means as one factor increases, so does something else. And inverse is as one increases, the other one goes down. Okay? I'm sure you can think of many examples of positive and inverse relationships. The more time you spend studying, the higher your grades. The more time you spend partying on the weekends, probably the lower your grades. Not to be too much, pointing at you guys, but, we want you to study. That is the end of part 4.